It is National Nutrition Month. And when we talk about the diseases of our time, a lot of times you hear in the sentence that it's in your genetics and you have to worry about that. And you certainly do have to pay attention, but we're also learning that food can allow us to change our genetics. It's fascinating. And here to talk about it is our ABC 15 Health Insider, Dr. Shadmar Vasti. Good morning.
Good morning.
So first, let's talk about when we say that we have a genetic predisposition, like say cancer runs in my family. We can't ignore that completely, right?
Yeah, absolutely. There's definitely risks associated with different genetic conditions. Even just the diseases of our time, like cancer, like you mentioned, there's things like cancer, diabetes, heart disease, definitely run in families. But the reality is that although genes are part of the equation in terms of the risk, they're not all of it. And in fact, they're not the vast majority of it. The reality is that our genes are not our destiny. In most cases for these common chronic conditions, actually our zip code and the way we live our life is actually more important than our genetic code. So these social, behavioral, and lifestyle determinants of health, where we live, where we work, where we play, the types of relationships we have, how we adapt to stress, and the food that we eat is actually critical for determining whether or not we're going to be sick or we're going to be healthy, and we're going to have a longer life that's healthy or a shorter life that's really, mired in illness and disease.
Right, because you've talked about frequently even certain diseases that with some of your patients, you've seen them be able to reverse their diagnosis and their outlook based on their diet.
Absolutely. And so what we're learning with this new field of epigenetics is that all of these things in terms of how we live our life, how physically active we are, and what we eat can literally change the expression of our genes for better or for worse. So epigenetics, epi means above and beyond our genes. So you can think about our genes like hardware, like computer hardware, okay? And then you can think about how physically active we are, the types of relationships we have, what we're exposed to in terms of stress or trauma, and what we eat as epigenetic inputs or software. So you can get good software that can optimize your hardware, right? The functioning of your computer, the functioning of your body, and that can upgrade you, right? And you can do much better. Or you can get malware or bad software, right? Or like a virus, think about that, and that can bring you down. So in the realm of food, we call this nutrigenomics. So what we eat can actually act as a messenger signal. So when we eat the standard American diet with over 70% processed foods or frankenfoods, like we've talked about, they actually turn on the pro-cancer genes, the pro-heart disease genes, the pro-dementia genes. And when we do the opposite, we actually can turn off those genes and then turn on the protective genes.
So when we're talking about doing a code rewrite of our body, how long are we talking here? Like, is it years to do this or something else?
This is the part that's truly amazing. It's actually not years, it's a matter of days and weeks. We can see literally changes in gene expression as early as 21 days. And you can see up to thousands of gene changes in about 28 days, just from changing your diet. And what's really amazing there is that our taste buds turn over every 21 days or so. And so in the same time frame that our taste buds can turn over and get accustomed to a new diet, like let's say, we see that a lot of people have a sweet tooth and there's tons of sugar, right? Added sugar in all sorts of forms in a lot of the processed foods that we eat. And if you avoid all of that for, let's say, 21 days, then your taste buds will change. And then when you try to go eat that candy bar or that processed food, that frankenfood that has loaded with sugar, all you're going to taste is pure sugar and it's going to gross you out.
Even if you think of it as a parent, when we look at our kids and they're first learning to eat, they love the foods that they're trying and there's nothing on them. They're eating it at its purest form. And so I guess that's for anybody who's thinking of trying this, that's where we start, is getting back to pure, real foods.
Yeah, you start with the real foods, and you basically do that for at least 21 days. You kind of stay strong, hang in there. And then things will kind of start changing. You'll start feeling the changes. I've had patients who start feeling more energy, have their moods are better. It's no wonder why diet, is the number one risk factor for preventable premature disease and death worldwide.
And that is pretty empowering when it comes to taking control of our own health. What a fascinating conversation, Dr. Shad. Thank you.
Thank you very much.